let the Vooka Nation know what initially drew you to this field of clinical psychology.
What? Wow, that's a very interesting question. And when I think about it, it's really remarkable to realize how far I've gone. Considering where I started, and what drew me to psychology. To be honest, it was just simply curiosity. I was very curious about understanding human behaviors. I was very curious about understanding why people do what they do. But it wasn't even about other people. It was more about me being curious about certain behaviors that I would see myself doing, and I'll be so frustrated with myself. So when I realized that there was actually a field that would help a person understand, how they behave, understand why they do the things that they do, that then fascinated me. I remember when I first came into contact with clinical psychology, my knowledge of it was through a TV show, Dr. Phil. And so, for me, obviously, it was like a distant dream. I mean, a black South African looking at this white male American as a clinical psychologist and thinking, wow, that could be interesting for me to do. But it didn't seem to be a possible reality at the time.
I can, yeah,
Yeah.
I can definitely understand why you would think that way, because we face so many issues here in South Africa, and many of them do affect us mentally. And like you said, you got the passion, or you wanted to know the human behaviors, what impact, what affects them, and why people act the way they act. I mean, as a child, I can relate to that, where I was often misunderstood. So I wanted to know what goes on in other people's minds, so that I can find a way to relay myself and express myself effectively. So I mean, you've worked with a wide range of people, so from military members to sentenced offenders. So those are quite, it can go those. I mean, military people do work with a lot of traumas, and offenders. Everybody wants to know what goes on in someone's mind when they commit some of these crimes. So, what have those experiences taught you about resilience in mental health and mental health? Sorry, not in resilience and mental health.
Yes, yes. So as you can see, the two populations are like polar opposite. I
Yes.
mean, when you look at the military members, these are the people that guard and safeguard our country. Those are the ones that protect our country. And then you look at the offenders; those are the ones that have violated the rights of the country. So you can see that there's quite a huge difference between these two populations. And what I learned about that was that in most cases, whenever we hear mental health, most people think that, only certain type of people will suffer from mental health conditions. And we tend to sometimes think that, it's because of lack of resilience. It's because you're not strong enough. It's because, you don't deal with your issues in the right way, so to speak. But then I got to learn from these two different people that it doesn't really matter who you are. Everybody is vulnerable to suffering from mental health conditions. And mental health has nothing to do with a person's strength or resilience. It also has nothing to do with a person's background or circumstances. So, we look at offenders, which are people that you would often think that, they wouldn't suffer from mental health, because of the things that they do. But then surprisingly enough, you find that those are the people in most cases who need the most help. So I think that, just to get to your point, the point that I was trying to get to, I mean, the question that you had asked, is that whenever we look at mental health, there isn't quite a connection when it comes to when we are considering a person's resilience as a protective factor from suffering from mental health.
Wow.
Very interesting. I mean, for someone who's listening right now, I know that they are getting a lot of information that they have missed, because mental health, is not a result of your background. Very interesting to hear that. But now, when you mentioned that the study of human behavior, because when you talk about psychology, is one of the fields that I try, to get into and understand what is happening. As we have seen, there are a lot of branches, and one of the branch that you are in is clinical psychology. So for someone, and for someone who's listening and watching right now, Like, how do you describe what you do?
Define. Yes.
Okay, so interestingly enough, we have quite different types of psychologists in South Africa that has been recognized. We have research psychologists, which are the kind of psychologists that you will find mostly in the academia. These are the psychologists that still research, some of the information that we end up getting, because psychology is a fairly young science. So we have those. We also have educational psychologists, and these are the psychologists that you would often find at schools. These are the ones that would deal with child development and how children are growing, the difficulties that children experience for the most part. And then we also have counseling psychologists. These psychologists deal with your everyday, issues. They deal with, like if I'm having marital problems, but it's not really a diagnosis. Like I'm not suffering from depression or anxiety or anything like that. It's just everyday challenges. So those are the counseling psychologists. We also have industrial psychologists, and these psychologists we find at the workplace. So they are the ones that would assist at the workplace to assist employees understand employers better, assist employers to understand employees better as well, and try to figure out, ways in which people can work in an environment and still, safeguard their mental health. And then we have neuropsychologists as well. And so this psychologists, they look more on the neurology of psychology. So they will look at your brain more and get into more the physiological aspect of our brains in relation to psychology. And then you have myself, which is clinical psychologist, which is we are clinical because we are able to work in hospitals. So you can find clinical psychologists in hospitals. But the interesting thing is that with clinical psychologists, we're not quite limited, because even if we want to do research, you can find us doing research as well. We can also do the works of a counseling psychologist, where we assist people with everyday issues. So it's not just depression and anxiety or clinical diagnosis that we assist people with, but we can assist across the board.
Wow. You just educated us right there. I didn't even know, that there was a research psychologist and
Mm.
all the other kinds of psychologists, because I've only obviously mainly dealt with just the one. So I know that you have two practices in Cape Town, like we mentioned when we introduced you into the segment. So, how do your two practices in Cape Town cater to the different community needs?
Mm. So the two practices that I have, um, they are at different locations, obviously, but there is similarities in terms of the population in which I work with. But what I've tend to come to notice is that within a population of people, you would all often find different communities, and these communities result from different socio-economic factors, and cultural factors as well, and many other factors. So I have made a conscious decision to be very deliberate when it comes to, engaging with communities and looking at the uniqueness of each community. So that helps me to be able to tailor my services specifically to the unique needs of each community that I work with.
I love that you said that, because now, I mean, having worked with the unique communities, what are some of the most pressing mental health challenges you're seeing in South Africa right now?
Mm, South Africa is quite an interesting country. And I'm not
Yes.
just saying that because I'm biased, I'm a South African, but we are very interesting. But then also, mind you, if you remember, South Africa has been, it has went through a period that many countries have not went through. What do I mean by that? What I mean by that is that we have a history whereby South Africa was under the apartheid regime. And that obviously has tailored the challenges that we find in South Africa, especially, when it comes to mental health, to be specific and unique to South Africans.
Mm.
And this is, most of us have suffered, enormous amount of trauma because of those 46 years of oppression and segregation, and just hate, really. And this has not only affected only Black South Africans, it has affected all South Africans. And so the challenges that I see mostly, that is, very common among South Africans, that I believe that it could be different in other countries, is the aftermath that we're still dealing with, from what we had to what we have experienced. And the fact that we're only just 31 years out of that traumatic experience that we've had, and we're still, battling and struggling. So if I am to just look at, in a holistic way, to look at the challenges that we are facing as South Africans, is that we are still, trying to, address that traumatic experience that we've had. And this is shown in the socio-economic challenges that we have. It's shown in other areas of our lives, because obviously it's affecting all those areas. So when you talk about, issues such as poverty, you talk about unemployment, you talk about, all of those things can be traced back to, the traumatic years of segregation and separation and oppression.
Yeah, and I mean, of course, in those years, a lot of that oppression would have been had to be psychological in order to, prevent certain actions being taken in society. So, in your experience, because here on the show earlier on, we expressed some stigma when it is the common stigmas that obviously in townships and Black communities mostly, that surround the issue of mental health. So, in your experience, how does stigma affect people's willingness to seek psychological help?
This has been, I'm so happy that you asked this question, because, this, I know it's in the heart of all healthcare, mental health care professionals. We struggle a lot when it comes to getting people to open up and have a willingness to come and seek help, especially when it comes to mental health. And, we cannot speak about stigma without actually speaking about misconceptions. A lot of people, are afraid and reluctant to seek mental health because of the misconceptions that people often have when it comes to what does it mean for me to actually say that I'm not okay. It's quite easy for me to say, okay, physically I'm not doing well. I can go and see the doctor, and no one is going to look at me in a strange way. Even I don't feel like anything shameful about me being physically ill. But the minute that I have to say I'm actually mentally unwell, what does that say? There's a lot of meaning that is attached to this that is not necessarily true. A lot of people associate being mentally ill as being psychosis. We are psychotic. I mean, we associate that,
True.
which is not necessarily the case. We also, associate being mentally ill with being weak. Like your problems, you must be able to deal with your problems. You must be able to deal with your stresses. But then we never look at it the same way as, if I am having a headache, it's still my headache. I should be able to deal with my headache, you see. So I would say the hesitancy for people to seek mental health, mental I mean, to seek help when they experience mental health issues, has to do with the misconceptions that still exist, which then, requires us to do programs such as, the program that you're having right now, so that we can educate people and people can get to understand that it is okay. That as a human being, there would be times that you're not doing well mentally, and there's absolutely nothing wrong with that. There's nothing wrong also with you reaching out and seeking help.
I love it. I love it.
Yeah.
And it's really great work that you're saying. And thank you for mentioning that here at the Vooka Breakfast Show. That's
Yeah.
what we're trying to do. We're
Yeah.
just trying to spread that awareness and obviously break the stigma around issues such as these. So, I mean, another thing, that we do here is Comedy Wednesdays, and we've had, somebody come in here talking about cultural beliefs and traditions. So obviously, we know how these can also affect our mental health. So, how do cultural beliefs and language shape our understanding of mental illness?
Mm,
Yes.
mm. Okay, so I'm going to start, looking at it from there is a common, there's a common beliefs that often, that you would often find, and this belief is across different races, it's across, different ages, it's across, different backgrounds, and this belief is that, whenever a person suffers from mental health, it is something that I think I've already touched on it. It's something that they themselves have to deal with and have to address. But then also, when you look at mental health, if we move away from just the general belief that a lot of people
Yes.
have, which I've
Yes.
already touched on, and you look at, specific cultures, for instance, as Black people, there are certain beliefs that we have, that you find that sometimes those beliefs comes from a traditional, and cultural values.
Mm.
And so, for instance, like, you find that, for us, there are times where we have to answer calls, like where there is, a traditional calling, when a person is, experiencing, a calling to be a traditional healer and things like this. And where people tend to think, if I am experiencing something like that, it has to be, I cannot then access, Western, help and assistance. And so, in some cases, you may find that some people, indeed, it is, when they start to, go through the process of being called to be a traditional healer or a psychologist, a sangoma, there are certain things that they would experience that in psychology we might query in terms of, is this person actually doing well, or is there something maybe mentally wrong with the person? And in most cases, we do find that there's absolutely nothing wrong with the person. However, there are in some cases where a person, it's not necessarily them, what they're experiencing, it's not necessarily because of a calling, or, it's not because they are supposed to answer to a certain a certain call to become a traditional healer or a sangoma. Now, because people don't understand that tradition can go hand in hand with, this Western approach, which is psychology. That's the belief that I find, hindering people from actually, getting help, especially, people of the Black communities. And so this is something that I thought it was very important that, in psychology, we have started to, work with traditional healers as well at certain times, whereby we will make referrals if we have seen a person and what they are presenting seems to be, leaning more into that direction. We also work with, spiritual, like religious Christianity, other forms of religion, where we are able to refer people to that area. So I think the belief that people might have, especially when it comes to spirituality, that you cannot mix spirituality with psychology, it's actually not correct. And also, when it comes to the second part of your question, where you asked me about language, how does, language then influence people's beliefs? In this case, it will speak back to the point that I've already touched, where we tend to label certain things not in the way in which they are,
Mm.
like seeking mental help. What kind of language do we usually associate with being mentally ill? A lot of people associate that with a lot of negative connotations. And in actual sense, every living human being, because you are a human being, at some point or the next, you might actually have a mental health, illness. And so it has nothing to do with this negative perception that we often have when it comes to mental health. illnesses and suffering from mental health conditions.
Hey, we are learning a lot. I can tell you, Miss Rabotata, because to tell you, I almost became a Mkulu generator. So with that information that you just given, I mean, it's the depth of the information that people need.
Mm.
But now I want to ask you, because you mentioned trauma, can trauma be handed down to generation?
Absolutely. So, what often would happen is that when trauma happens, like when a person experiences trauma, that trauma shapes their thinking. It has a way of structuring your thinking in a way in which, it's not functional. And it is a way of affecting your behaviors as well, in a way in which is not functional. So, how trauma gets, transferred, as you would say, how a person can get, have trauma just because they've inherited it from maybe their mother or their grandmother. It will happen through how that person is treated by the person who experienced the trauma in the first place. Like, for example, if you look at, let's say, a woman goes through like a very traumatic experience, and then that trauma obviously shapes her thinking, and this woman then has children. The way in which she's going to raise those children, obviously, because her mind has been affected and her mind has been altered by the trauma, she might most likely raise the children not in a way that is, how can I say, not in a functional way, because already her thinking is being compromised. And as those children are experiencing that mannerism in which she's raising them, they themselves becomes traumatized because the way in which they're being raised, it's not healthy. So that's how trauma gets passed on. It cannot be passed on genetically, but it can be passed on through how we then treat those that we are responsible of. And through that, then they then get traumatized from how we engage with them, and then it's passed on.
Mm. Wow. I love the subject because I do always say on the show that I am a mental health advocate, and having these kind of conversations assists even me as somebody who does and has been diagnosed with mental health conditions, where now you destigmatizing, these mental conditions, and to say, guys, it's not good to this person. They not in a way, like, I'm going to put it in air quotes, normal, because like you're saying, language is very important in how we put these things and how we label these things.
Mm.
So I mean, now we know that like, now when you're talking about how trauma is passed on, families and individuals are able to affect families. So now we're going to go into the practical advice that you can give individuals and families on how they can obviously recognize the signs that a loved one may need help, and of course the importance of early intervention, and obviously normalizing therapy in everyday conversations. So what are some of the early signs of mental distress that people often overlook?
Mm. So there's a simplest way in which psychology, define mental health illnesses, and that way is to say, whenever a person is struggling to function in more than one setting, then that already creates a query of a mental health illness. So I'm going to touch on two parts of what you had asked. So the one part would be when a person is starting to present with symptoms that might lead to a mental health condition. And then the second part would be when a person is actually having a mental health condition. So starting with the first part, which is when a person is presenting with symptoms that could lead to mental health, the one thing to look at is the change in behavior. That's the number one thing to look at, and not to look at it in others, but we can also look at it in ourselves.
True.
Like, for instance, if you start to notice that, lately you haven't been sleeping well, You are somebody who used to sleep for 8 hours, and all of a sudden, you only can sleep for like 4 hours, and you're up again. That could be another indicator. It seems to be like a simple thing if you really look at it. It's like, oh no, I haven't been sleeping these days. But if this becomes a persistent thing, that it's happening to a point where now you're struggling to function, that's one of the indicators. Another indicator could be noticing that you haven't been eating as much as you used to eat. Noticing that you haven't been as energetic as you used to be. So these subtle little changes in our behaviors can be great indicators in us being able to say, wait a minute, I think maybe there might be something I'm overlooking. Maybe there's something that actually needs my attention to look into. So that's the first part of it. And then the second part of it would be when a person actually have a mental health condition. Now, in this situation, it's when a person is now seriously struggling. Like, for instance, at your workplace, you're really struggling to do the things that you used to find easy to do. You are struggling to meet deadlines. You are struggling to be at work on time. You are struggling to focus during meetings. You are struggling to remember things. So now, in that case, there is a possibility that you're not only just maybe having, symptoms, or you're not just vulnerable to suffering from a mental health condition, but there's a possibility that there could be maybe a condition already that needs to be addressed.
Hi, Ms. Rabotata, Afriberry here. So, this one basically goes to maybe encouraging the students per se who are interested in psychology, because I feel like this is something that we should also encourage the upcoming youth to also tap into in terms of basically handing out relief to the nation and to themselves as a whole. So, when it comes to the different practices under psychology. Okay, so I'm going to name the few that I found. Would you also mind going briefly into what they have to offer individually themselves and the benefits of them with regard to mental health as a whole? So when it comes to the different ones that I found, so I found that we have behavioral, cognitive, biological, cross cultural, evolutionary, and humanistic behavior, right? So can you kindly please explain the differences between all of those and what impact they play when it comes to basically dealing with a person's mental health, and how one can possibly maybe cope with having either one of them when they found themselves at home and not being able to go to a clinic or being able to go to a clinical psychologist for help.
Okay, so the things that you've just noted down, those are different, how can I say, different sections, different disciplines in psychology. I heard you speak about behavioral. Is that correct?
Yeah, she said
Yes.
behavioral and cognitive
Yes.
something. Yeah.
Yes, behavioral and cognitive. Oh, okay. So when you speak about uh, there is a modality called cognitive behavioral therapy. So in psychology, we have different modalities, which are different approaches in which we are able to offer help. One of those modalities is cognitive behavioral therapy, which is a therapy that helps us to engage people's thoughts in order to change their behaviors and change how they feel and improve their quality of life. Now, these we have over 400 actually modalities in psychology that we can utilize as psychologists, and so even with cognitive behavioral therapy, just being specific with that, there are certain skills that a person can be able to utilize at home to help them to deal with if they're having like mental health issues or mental health struggles, but then it would be tailored to whatever the person is experiencing. So I'm not quite sure if I understood understood your question correctly, and if I missed it, please you can help me. But I think what I'm trying to answer is to say that there are different modalities in psychologies, and some of these modalities we are able to present them to our clients in a way in which they're able to utilize some of these tools and these skills themselves.
Yeah,
I
yeah.
think you, yeah. So I think you did answer because, yeah, I do know from, like I said, my own personal experience. That's one of the therapies I had to take, being admitted at a facility called Akiso. So I know we've been talking a lot, on this matter, but just now I want you now, what to just let me know what your hopes are. So, what gives you hope about the direction that mental health is taking in South Africa?
Mm. I am really excited. I'm really very excited. First of all, I will say again, shows like this. Thank you so much to you
Yeah,
guys
yeah.
one more time. It's shows like this that shows us that we're moving in a very positive direction. Because there are a lot of platforms that I see nowadays that are being created to create, to be able to provide awareness to people so that people can know better about mental health, and so that we can also normalize these conversations. Another thing that is also very exciting, when it comes to mental health and in South Africa specifically, is the fact that there has been an emergence of African psychology, which is the kind of psychology that looks at African beliefs, African values, African traditions, and it's tailored to be able to, assist African people. So that for me, it's a very positive thing, especially considering the fact that in South Africa we are a very diverse nation,
Mm,
and so we psychology tries as much as it can to not be limited to certain type of people, so that it can be able to cater, the differences in people and be able to help people. So it's quite exciting because also in South Africa, mental health is something that we push forward. There's a lot of investment that goes into mental health, in for us, as a country. There's a lot of investment that goes in financially. There's also a lot of investment that goes in terms of, creating times and opportunities for people to gain better understanding, as far as mental health is concerned.
I love, when I hear you speaking that you are excited, and that smile, man, it brings hope to a lot of hopeless South Africans. But now, I just want to ask you before we close off, that as a clinical psychologist, do you think as a society we're getting better or worse?
mentally,
Mm.
psychologically.
Whoa, that is quite a question that you asked me there. As a society, are we getting better or worse? Okay, I would say yes. I would say we are getting better, and I would say we are also getting worse. And then I will explain the reason why I say that. Um, I will start with us getting worse. Nowadays, we're living in a time and age where technology has completely taken off, and because of that, technology is wonderful and great. I mean, how can we not appreciate it? I'm able to have this interview with you right now. Well, I'm all the way in Cape Town, and you are there in Gauteng because of technology. So we really appreciate technology and the benefits that it brings in our lives. However, there's a different aspect of technology that when we don't use technology responsibly, it tends to, work against us rather than work for us. And that is, the amount of time that people often use, spend on their phones, the amount of screen time that people have, and the fact that this time has now taken away that, contact, the physical contact that human beings used to have. So as a result, you find that a lot of people nowadays suffer from loneliness. A lot of people nowadays suffer from depression because of the isolation that happens, as a result of us overusing technology. I would say also another aspect that I see that is starting to pop up quite a lot is a lot of children now have been affected, with also, the screen time and it affects their concentration, it affects their memory. There's also a dopamine aspect to it, where people now are operating on high levels of dopamine because of constant stimulation on their
Mm.
social medias and so forth. And so that's the aspect that I would say, it has brought a different dimension into our lives, and it has definitely brought a different challenge as far as mental health is concerned. Now, on the flip side of that is that we are now starting to be intentional when it starts to having conversations when it comes to mental health. And so we are getting better because we are not just sitting back and saying, okay, something needs to change. But a lot of mental health professionals have actually made it their goal to be intentional in educating people and getting people to be comfortable with utilizing our services and being able to be helped. So for the most part, we have come a long way in terms of the number of people who are now comfortable with accessing mental health professionals in order for them to receive the help that they need.
So before we close off, if there's one message you'd want every viewer and listener of the Vooka Breakfast Show to remember this Mental Health Awareness Month, what would it be?
Mm. If there's one message that I would want everybody to remember is that we need to be able to be aware of the fact that as our body can get sick, so does our mind also, get sick. That as normal as it is for me to have the flu, it is also normal for me to experience mental health distress and find myself in certain situations where I might also have a mental health condition. Mental health conditions are not for certain type of people. Any human being, including myself, is vulnerable to experiencing mental health. And at some point or the next, I would say a huge number of people, if not all of us, will suffer from one mental health or the next. So I just want people to get to know that there's absolutely nothing wrong with you having a mental health condition or having mental health distress. You need to know that it doesn't mean that there is something wrong with you, but this is just the normal, way in which is the nature of human existence. All of us at one point or the next, we might find ourselves in that situation. And so, because it is so, there's no need for you to feel ashamed at all.
It's the nature of human existence. A powerful parting message there. So, for anybody listening and watching, where can they find resources that get in touch with you if they require help?
Mm. So the easiest way to get in touch with my office, my practice, is through we have a WhatsApp number and also a number for calls. And the number is 081-753-5344. So you're more than welcome to call us directly or to WhatsApp us, and there it is on the screen. You can also find us on Facebook. On Facebook, the practice goes by the name of Mind Care Center. So if you just search for Mind Care Center, you will find us there, and you can engage where we give out resources as tips on how to manage your mental health, and also certain talks that I might be doing, or just information around what the practice is it's up to. You can find it there. You can also find us on YouTube as well. On YouTube, we are at Mind Care Center International, or you can just simply just type in my name and say name. That is Maite Rabothata, and then it will pull up my channel, and then the channel of the practice, obviously. And yeah,
Ah,
those are the places where you can find this.
Thank you. Thank you so much, Maite, for such a powerful and compassionate conversation, man. As we wrap up the mental health, well, we're not wrapping it up, but you know what? We're going towards the end of Mental Health Awareness Month. We're reminded that mental wellness is not a luxury, but a
Mm,
necessity. So, whether you're
mm,
seeking help, supporting a loved one, or advocating in your community like myself, remember that every step towards understanding matters. And we want to thank you, Maite, for helping the Vooka Nation understand this issue better. So to you, our listeners and watchers, to you, Vooka Nation, you're not alone. There is help and there is hope. So we'll leave helpful links on our pages for you, to go back to whenever you require, Miss Maite's details. And you can go back to this episode on Vooka Clips, like with every other interview that we've done. Until next time, keep tending to your mind, because every mind matters. This was the Mind Basket with Maite Rabothata.